One of the most underreported symptomatic improvements a patient undergoes under upper cervical care is an improvement in their overall digestive health. Present day, there's a lot of fads going on with regards to gut bacteria, microbiome. What do we need to do to supplement this? Do we need certain types of probiotics? Do we need certain types of bacteria? Does our dietary change need to take place? And I would say that in some instances, it is super important to talk about diet, right, as an overall nutritional composition, but that's not the place of an upper cervical doctor. We may have some understanding of it, right, some conversation, maybe because it's a personal interest. But beyond that, our conversation is more about how your neck, more specifically the first and second bone, are responsible for coordinating and controlling the brain to body communication. And what's really fascinating about this is that if you become completely mechanistic, meaning that your sole focus is on neurophysiology, we understand that the digestive system is under direct regulation of the vagal nerve. Now, many of you have heard of this as being something that is important with regards to the fight or flight or the rest and digest situation that we face in our life. Unfortunately, in the West, a majority of us live in this fight or flight paradigm, giving us poor digestion, poor bowel movements, poor bladder control, poor issues with regards to our gut. We start getting acid reflux. We start having some issues with regards to how well we absorb nutrition, etc. And what we can tell you and what we do know and what has been researched is that the vagal nerve is directly controlled by the position of your first bone in your neck, C1. It is called the atlas bone. And the anterior nerve root, right, the one that's on the front of the bone of C1 is your vagal nerve. So if you have a malposition of this bone and it is chronic over time, there will be a change in your vagal tone, meaning that your ability to regulate sympathetic and parasympathetic, or fight or flight and rest and digest, will be discredited, will be destroyed, will be not efficient, will be in what a word I got for you for this is that it will not work properly, period. And so dysfunctional. How about that? There we go. So what we do know is that when we restore autonomic tone, when we restore vagal tone, when we give the right adjustment at the right place at the right time to the first bone of your neck, it is only a principle of time that will allow the vagus nerve to restore normal neurophysiology, allowing your organ systems of digestion, being your stomach, your small intestine, your large intestine, and your rectum, to actually heal. And when they heal, you'll be able to eradicate those symptomatic expression of constipation, of IBS, of chronic diarrhea, of going through some of the issues that are associated with Crohn's and lupus, etc. And so my challenge to you this month is that if you are someone you know is struggling with digestive issues, consult an upper cervical doctor. Have them show you that a neck problem is or is not present. And if it is present, go through the recommendations of care to restore normal neurophysiology so that you can get back the quality of health you deserve. I hope this is educational. Recognize that vagal tone is everything as it relates to digestion.